Every deadliest cancers in human history explained. Lung cancer. Lung cancer is the deadliest cancer on the planet. It kills more people every year than breast, colon, and prostate cancer combined. It starts in the lungs, the two organs your body depends on to breathe, to move oxygen into your blood, and to keep every other organ alive. Most of the time, it begins in the cells lining your airways. Something damages the DNA inside those cells, and instead of repairing or dying like healthy cells do, they start multiplying without stopping. Smoking causes about 85% of cases, but air pollution, radon gas, and plain bad luck can trigger it too. The cruelest part is the silence. Early lung cancer has no pain, no cough, no warning. By the time symptoms appear, the cancer has usually already spread. Your lungs give you life. Lung cancer takes that quietly, from the inside out. Pancreatic cancer. The pancreas sits deep in your abdomen, tucked behind your stomach, quietly doing its job. It makes the enzymes that digest your food and the hormones that control your blood sugar. Most people never think about it. That invisibility is exactly what makes cancer here so devastating. Pancreatic cancer grows without any signals, no pain, no lump you can feel, no obvious warning. The organ is buried so deep that even scans can miss it in the early stages. By the time a person feels something wrong, the cancer has almost always already spread to nearby organs or the bloodstream. Around 95% of people diagnosed with the most common form do not survive past 5 years. There is no routine screening test, no early detection system. It is not that treatment fails. The problem is that by the time anyone knows it is there, it is already too late. Liver cancer. The liver is one of the hardest working organs in your body. It filters your blood, processes everything you eat and drink, and repairs itself when damaged. That last ability is remarkable. But it is also the reason liver cancer is so deadly. When the liver gets damaged over years, whether from hepatitis B or C, heavy alcohol use, or fatty liver disease, it keeps rebuilding itself. Scar tissue forms, cells divide rapidly to patch the damage, and somewhere in all that frantic repair work, a cell makes a mistake. That mistake becomes cancer. Because the liver is so good at compensating, it keeps functioning even as a tumor grows. Symptoms only appear once the damage is severe. Jaundice, swelling, pain. By then, the tumor is large and often untreatable. The liver's greatest strength, its ability to silently endure, becomes the very thing that lets the cancer win. Colorectal cancer. Colorectal cancer starts in the colon or rectum, the final stretch of your digestive system. It begins not as cancer, but as a polyp. A polyp is a small, harmless clump of cells that grows on the inner wall of the colon. Most polyps never cause problems. But given enough time, some quietly transform. Over the course of 5 to 10 years, a polyp can mutate, grow deeper into the colon wall, and become cancer. Then it spreads to lymph nodes, then to distant organs like the liver and lungs. The whole process happens with almost no symptoms until the later stages. Some bleeding, some changes in digestion, easily dismissed as something minor. Here is what makes this particularly painful colorectal cancer is one of the most preventable cancers that exists. A routine colonoscopy can find and remove polyps before they ever turn dangerous. Most people skip the screening. The cancer grows anyway. Breast cancer. Breast cancer is the most commonly diagnosed cancer in women worldwide. It starts in the cells of the breast, usually in the ducts that carry milk or in the lobules that produce it. One cell gets a damaged instruction, divides wrong, and keeps dividing. A tumor forms. What makes breast cancer dangerous is not just the tumor itself. It is the journey. Cancer cells can break away from the original mass, travel through the lymphatic system, and plant themselves somewhere else entirely. The lymph nodes under the arm are usually first. Then the bones, lungs, liver, or brain. Caught early, survival rates are high. Caught late, after the cancer has spread beyond the breast, the odds shift dramatically. That gap between early and late detection is measured in years of life. Early detection does not just improve outcomes. In many cases, it is the entire difference. Stomach cancer. The stomach is a tough organ. It produces acid strong enough to break down almost anything you swallow. But that same harsh environment can, over decades, become the reason cancer takes hold. Stomach cancer is closely linked to a bacteria called H. pylori, which lives in the stomach lining of roughly half the world's population. In most people, it causes no problems. In some, it triggers chronic inflammation, and that constant low-level damage slowly corrupts the cells lining the stomach wall. A diet heavy in salted, smoked, or pickled foods accelerates the process. The stomach keeps digesting, keeps functioning, while a tumor quietly expands inside it. Symptoms, when they finally arrive, feel like ordinary indigestion, bloating, mild discomfort, a loss of appetite, easy to ignore for months or years. By the time the pain becomes undeniable, the cancer has usually spread well beyond the stomach wall. Esophageal cancer. The esophagus is the tube that carries food from your mouth to your stomach. It is about 10 inches long, and most people never think about it until something goes wrong. When cancer grows here, the first sign is usually difficulty swallowing. Food gets stuck, then liquids. Then, nothing goes down easily at all. Esophageal cancer is strongly linked to years of acid reflux, smoking, and heavy alcohol use. Repeated acid damage inflames the lining of the tube, cells mutate under the constant irritation, and a tumor begins forming in the wall. The esophagus sits surrounded by vital structures. The airway, major blood vessels, and the spine are all close neighbors. This makes surgical removal extremely difficult and gives the cancer easy access to spread rapidly into nearby tissue. Swallowing is something every person does hundreds of times a day without thinking. Esophageal cancer turns that unconscious act into a daily reminder of how much has already been lost. Glioblastoma. Glioblastoma is the most aggressive brain tumor a person can develop. It starts in the glial cells, the support cells that surround and protect your neurons. When they turn cancerous, they do not form a clean, removable mass. They send microscopic tendrils deep into healthy brain tissue, weaving themselves into the organ itself. Surgeons can remove the visible tumor, but the roots stay behind. The cancer regrows, almost always within months. What makes glioblastoma uniquely cruel is where it lives. As it expands, it presses against the parts of the brain responsible for memory, personality, speech, and movement. The person begins to disappear before the body does. Most patients survive less than 15 months after diagnosis. The brain has no way to fight what is already growing inside it. Cervical cancer. Cervical cancer starts at the entrance of the uterus, and in almost every case, it traces back to a single cause: a virus called HPV. Human papillomavirus is so common that most sexually active people carry it at some point. The immune system usually clears it. But in some people, certain strains of HPV quietly infect the cells of the cervix, corrupting their DNA over years until they turn cancerous. What makes this particularly devastating is that a vaccine exists. Routine screening through a pap smear can catch precancerous changes before they become dangerous. Yet cervical cancer still kills around 350,000 women every year, the vast majority in low-income countries where vaccines and screenings are out of reach. A largely preventable cancer. Still one of the deadliest for women on Earth. Leukemia. Leukemia is cancer of the blood. It starts in the bone marrow, the spongy tissue inside your bones where blood cells are made. Something goes wrong during cell production, and instead of creating healthy white blood cells, the marrow begins churning out defective ones. These abnormal cells do not die when they should. They accumulate, crowding out the healthy red blood cells and platelets the body desperately needs. Without enough healthy blood cells, the body cannot carry oxygen, cannot clot wounds, and cannot fight infection. Patients bruise easily, exhaust quickly, and fall sick repeatedly. Acute leukemia moves fast. Within weeks of onset, the bone marrow can become so overwhelmed that the body begins failing at its most basic functions. The very system designed to protect you becomes the source of the threat. Ovarian cancer. Ovarian cancer develops in the ovaries, the two small organs responsible for producing eggs and hormones in women. It has earned the name silent killer because it produces almost no recognizable symptoms in its early stages. Mild bloating, a subtle feeling of fullness, a faint ache in the lower abdomen, the kind of discomfort most people attribute to digestion or stress. While those vague signals go unnoticed, the cancer spreads across the abdominal cavity, coating surrounding organs in a layer of malignant cells. By the time a diagnosis is made, around 70% of cases have already reached an advanced stage. There is no reliable early screening test, no simple blood check, no routine scan. Ovarian cancer grows in silence, and the silence is what gives it time. Melanoma. Melanoma begins in the melanocytes, the cells that give your skin its color. When ultraviolet radiation from the sun or a tanning bed damages the DNA inside those cells, some of them stop behaving normally. A mole shifts shape. A dark spot appears where there was none. It looks small, manageable, easy to dismiss. But melanoma is uniquely dangerous because of how readily it travels. Skin cells have direct access to both the lymphatic system and the bloodstream, giving the cancer a fast route to the lungs, liver, brain, and bones. Caught at the surface, melanoma is highly treatable. Once it reaches deeper layers and enters the bloodstream, survival rates fall sharply. The warning was always visible. That is the part that makes it hardest to accept.